my name is Massimo, and I am a postdoctoral fellow in the University of Pennsylvania Frontotemporal Degeneration Center, and I have a joint appointment with the Penn State University College of Nursing. So frontotemporal degeneration, or FTD, is a progressive neurodegenerative disease that affects individuals in their 50s and 60s. FTD affects the frontal and the temporal lobes of the brain and causes significant changes in personality and behavior, and can also cause language difficulty. So in our study, we looked at occupational attainment's effect on survival in FTD. So we didn't look at incidence of dementia or progression, but we did look at essentially, we looked at disease duration. And we found that people who have higher occupational attainment, so people like engineers, lawyers, doctors, in the professional world, that they lived significantly longer than individuals who were in lower occupational levels, such as laborers, for example. And we are now currently actually investigating whether the disease trajectory or the clinical progression is longer in people with FTD. So this whole notion of cognitive reserve, or essentially the brain's way of buffering against neurodegenerative disease pathology, has been studied in other types of dementia, like Alzheimer's disease, for example. And what researchers have found that in Alzheimer's disease is the opposite of what we found in FTD. They found that people who have higher occupational levels actually had shorter survival than people who had with lower occupational levels. So unfortunately, individuals who are affected with FTD are typically not able to continue working because the brain affects their personality and their behavior so profoundly. However, there are other ways for the brain to continue to stay active, if you will. So things like attending community centers and staying active that way, or physical fitness and physical activity we know is also really good. So just walking, 15 to 20 minutes a day can also be helpful for individuals with FTD. So as I mentioned, we're currently investigating the effect of occupational attainment on cognitive decline in FTD. We're also looking at other markers of cognitive reserve, things like education, for example, or cognitively stimulating activities. So whether an individual was active, throughout their life, and whether that contributes to cognitive reserve in FTD. These are all things that we still don't know the answers to, but that we are currently investigating.